Okay, and what sort of reaction are we looking for? Is it, from mild to severe? What would be the first signs that my child was allergic to something?
So generally a reaction occurs between 5 minutes and 30 minutes of ingesting a food, but can happen up to 2 hours after.
Okay.
And it depends on the child. And there's different types of signs and symptoms we see. And what you've had one time, you don't necessarily have the next time. But generally what we see is there's two types. We have our mild to moderate allergic reaction, and that is where we have signs and symptoms of an allergic reaction that don't involve the breathing or the heart, which is anaphylaxis. And so really common ones would be swelling of the eyes, lips, urticaria, which is the welts or itchy bites you commonly see on skin, sometimes tummy upset, so vomiting. Those are kind of signs and symptoms that you're having a mild to moderate reaction, and it doesn't necessarily look moderate or mild when you're the parent. It can be really severe in symptoms. So they are still, we call it mild to moderate because it's not severe as in anaphylaxis.
Okay. So what is anaphylaxis, and when do I administer the EpiPen? How do I know?
So anaphylaxis is a type of reaction that involves your breathing or your heart. So when I educate whānau on it, I always say that's the question I want you to stop, even though it's an emergency situation, stop, take a breath and ask that of your child or yourself if you're having a reaction. Does this involve my breathing? Does it involve my heart? And do you want to, on the action plan, the signs and symptoms are there?
Absolutely. So the red action plan is for anaphylaxis. So anaphylaxis is that life-threatening, severe allergic reaction that, as Amy said, involves the breathing or the heart. So some of the signs to watch out for anaphylaxis, and bearing in mind we only need one of these, not all of them, is difficulty or noisy breathing, wheeze or persistent cough, swelling or tightness in the throat and swelling of the tongue, difficulty talking or a hoarse sounding voice, or an unusual sounding voice for the child or person, and persistent dizziness or collapse, and in young children they can become very pale and go floppy.
And so if you have any of those signs or symptoms, that by definition is anaphylaxis. You might start off with the mild to moderate reaction we talked about, where you have some hives and it progressed to anaphylaxis, or anaphylaxis can just present on its own just with those signs. And like Emily said, you only need one. So if you've answered that question, does it involve my breathing? Does it involve my heart? And it's a yes, then we're managing it as anaphylaxis. We don't worry about antihistamine like we do in a mild to moderate. We're managing it as anaphylaxis.
Giving the EpiPen.
Yeah.
Lying them down and giving the EpiPen.
Yeah.
Really important to lie them down.
Why do we need to lie down?
Well, in anaphylaxis, our blood pressure drops. And part of our blood pressure's role is to push the oxygenated blood around our body. So if you're standing up in an anaphylaxis and your blood pressure is low, it's hard to get that oxygen to your brain against gravity. So we want them to sit down or lay down if they can, to help make sure we've got all of that surrounding the brain. And that's the first thing we do. If they don't have access, someone else to get the EpiPen, then it would be appropriate for them to get it, but really important that they sit down or do lay down is the first thing, and stay laying down regardless of the treatment. Then the second point is that we would give the EpiPen then, and then the third is to phone an ambulance, and we do it in that order. And when you phone an ambulance, they can talk for a long time, and we've already answered that question, that it involves the breathing or the heart, and we know the medication that we want to give for anaphylaxis is the adrenaline. And so we've got that in our hands, so we're going to treat first and then phone the ambulance, and then the ambulance is on its way. And regardless if the adrenaline then makes the child or the adult really well quite quickly, which it will, but we still want them to phone an ambulance regardless, because there's a small percentage of children or adults that will have a rebound anaphylaxis within 4 hours. So we want them to be in ED monitored for that period of time. And should they need a second dose of adrenaline, the ambulance can bring that second dose if they need one, which after 5 minutes, if they've still got signs and symptoms of anaphylaxis, they can have a second dose or a second EpiPen if they carry one.